Republicans say that this healthcare system is a socialist takeover, that the government can force you out of your insurance company, force you out of your doctors, when that's not the case at all. It's an option. You're able to do that. You're able to, if you don't trust your insurance company, if you feel like they're cheating you, you're paying too much, you have this other option to go to. And Obama said you can keep your doctors, you can keep your insurance company. We're not forcing you to do anything, we're just giving you another option. And now the money. Republicans say it'll cost $1.2 trillion over 10 years for this healthcare system. Okay. Well, other than just throwing numbers at people, why not look and see how much money we're paying without it? My friend and I decided to do a project. We called his county. We called the county where he's from, which is up in North Idaho, which has 20,000 people. We called them and asked them how much money they've spent in 2009 on indigent people's emergency room visits. Indigent people are people that don't have health insurance. So, those people's emergency room visits, the people that don't have health care, are paid for by the government and taxpayers. So we called this county and asked them how much money they've spent on indigent people's emergency room visits in 2009. They said $500,000. Okay, $500,000 on a population 20,000 county. So if you take that, so you say, okay, that's 20,000 people, and there's 300 million people in the U.S. So if you take 300 million and divide it by that 20,000 people, you'll get 15,000. So you go 15,000 times the 500,000 that we pay on each group of 20,000 people, and it equals out to $7.5 billion just in 2009 for people that don't have health care insurance that go to the emergency rooms. That's out of taxpayers. Now, the Republicans said it cost $1.2 trillion in 10 years. So $7.5 billion times 10 is $75 billion in 10 years. But wait a minute. The thing is, though, that when we called, we learned in 2008 the county paid $460,000 on indigent people, and in 2007 they paid even less, closer to $400,000. So the amount they're paying is going up each year, let's say by $40,000. But wait a minute. So not only is the amount they're paying every year going up, and that's like, going up by $40,000 a year, which is a lot. But the thing is, when we called in early November. So 2009 wasn't even over yet. It had 2 months left to go. And it was already at $500,000 they've paid on indigent people's emergency room visits. And, at the time we called, who knows when they've last updated that information. That could have been from even a month before or 2 months before. So, when you factor all that in, there's no telling how much we're paying on just emergency room visits for people that don't have health care in 10 years. It could probably easily go as high as, half of the $1.2 trillion that Obama is supposedly going to spend on this healthcare bill. And like I said, that's just emergency room visits for, a county where, a lot of people in the county work. There's a lot of people with money in the town, and, a lot of people have health care. And when you take like a big city like LA, you got so many more factors that are contributing to, you got air pollution, you got smog and everything, which gives people asthma, lung disease. It could even give you cancer and, stuff like that, sends people rushing to the emergency room a lot more. So, this new healthcare bill is really needed. Not only does Obama need to pass it so we can move on to other things, but, the actual bill is very helpful. It'll give people coverage, it'll give people security, it'll give people another option, another thing another way to go if their insurance company isn't doing for them what they need it to be doing. It'll give competition to the insurance companies so they can lower their rates. It's a good bill, and it highly benefits the public. So, ask yourself, who would oppose a bill like this? Insurance companies. Who would a bill like this hurt? Greedy insurance companies. Who would a bill like this help? The public. Who would oppose a bill like this? That's all I'm saying. Who would oppose a bill like this? So that's pretty much all I gotta say. Leave me a comment. Tell me what you think. If you've watched this whole video and you still oppose the healthcare system, write me a comment. Tell me why, and I will come up with an answer for you. So leave comments, rate, and subscribe. I'm out.